This conference will now be recorded.
Oh, good afternoon, everyone. Welcome back to the ACRM Pandemic Webinar Series. Happy Friday to everybody. Well, I'm sure that it has been a long week for pretty much everybody on the call. In this series, we are hosting guests from lots of different groups, PTOT, SLP, trying to help navigate the telehealth, telemedicine, ever-changing landscape. What can we do to repurpose our rehab resources and getting telemedicine, telehealth off the ground, and hopefully get paid for it. Today we have Lloyd Sirmons, the Southeastern Telehealth Resource Center, SETRC director, one of 12 federally funded telehealth promotion centers. We've, up until this point, spent a lot of time focused on changes to reimbursement and policy. Hopefully, everybody's kind of seeing the direction that CMS and privates are going as far as encouraging tele-rehab to get off the ground to deal with this pandemic. And so we're bringing Lloyd on today to talk a little bit about what resources are out there. You know, if you're going to start heading down this path, what resources are out there in regards to telehealth and telemedicine that your organization can tap into to begin to build a program. Lloyd's the director of the SETRC, which is part of the National Consortium of Telehealth Resource Centers, federally funded by the U.S. Department of Health and Human Services, Health Resources and Services Administration, and the Office for the Advancement of Telehealth, which is part of the Office of Rural Health Policy. The SETRC serves as the regional telehealth resource center charged for advancing telehealth by providing technical assistance guidance with all aspects of telehealth implementation. So for their group, they cover Alabama, Florida, Georgia, and South Carolina. But whatever state you're in the United States, you have a telehealth resource center, a federal center that's responsible for your state and area. And they all kind of operate, from what I understand, in the same way. So while Lloyd is responsible for the Southeast, he's addressing the broader picture. So these resources are available in your state as well. So without further ado, Lloyd, welcome. Thanks for coming on the show.
Thank you very much, John, and it's been great working with you, and thank you, Terry, as well, for helping us get all set up and for giving us the opportunity to share today. As you can imagine, as things have been rapidly changing, we have been very busy as telehealth resource centers. The interesting thing is not a lot of people, there's still a lot of people who do not know about the telehealth resource centers and all the things that we do. So hopefully by the end of the day, that's one of the things that you will have a better understanding of, is the resources that are available for you. And that's kind of what I'm hoping that I will be able to help you with today, is direct you to areas where you can find information that's readily available, because there's so much information that's coming out today. It can be very difficult sifting through and really figuring out what's credible and what's not. So my disclosure, I nor the Southeastern Telehealth Resource Center has any relevant financial interest or arrangements or any affiliation with any organizations related to commercial products or services discussed in the program today. Please understand that information that I provide for you today is not to be regarded as legal advice. So the information that I give today is for informational purposes. So you will always want to consult with legal counsel when necessary. Today, as I said, one of the things that I really, kind of want to do for you is to provide you with an area of resources. I think that right now, with the times being the way they are, the biggest need that I have seen as far as people contacting me, as well as the other telehealth resource centers, is, information. I mean, information right now, it's coming at people left and right. They're having difficult times sifting through the information. And so what we do as resource centers, we do a very good job of pooling the resources together and providing folks with kind of a one-stop shop. I know the majority of us as resource centers, we have resources, resource pages on our websites that are keeping updated information the best that we possibly can. We'll discuss best practices for starting virtual care, updates around COVID-19, the most recent waivers, and some of the changes that we're seeing there. And I'll discuss a little bit of the conversation that we're having as well around PTOT and speech language pathology services. And then we'll talk a little bit about coverage and some of the reimbursement stuff. I do want to give you a caveat. I'm not a billing expert by no stretch of the imagination. And so if you do have more specific billing questions, you are more than welcome to reach out to me, and we will try to find an answer to your question as best as possible. So I always like to throw that out because we do touch base on some reimbursement stuff and some billing, but I'm not a billing expert. And when it gets into the weeds, then I start looking for other resources myself. So this is just kind of a map that shows you who we are as resource centers and where we are. As John said, there are 14 total telehealth resources centers. We are federally funded through the Health Resources Services Administration. We are a part of the Office for the Advancement of Telehealth. So we are, we're a grant program, or actually we are a cooperative agreement program through HRSA. There's 2 telehealth resource centers that are national resource centers. The Center for Connected Health Policy. Many of you may be on their mailing list. If you're not, I would encourage you to visit their website and sign up for their mailing list. They deal with policies at a national level. May does a really, and her team does a really good job of keeping up to date and up to speed on changes that come out of Washington, as well as some of what each individual states are doing as well. There's some great resources there. So go out to their website, sign up for their newsletter if you haven't done so already, so that way you get those updates. Also, they do legislative updates, and we typically, as the regional resource centers, will disseminate that information to our constituents once that information is updated, and they typically try to update what's going on at the state level about every 2 months. So, and then there's TTAC, the Telehealth Technology Assessment Center, which deals, as you can imagine, with technologies around telemedicine. They're a great resource if you have questions around technology and platforms and things of that nature. They can be a great resource for you as well. And then, of course, the 12 regional resource centers cover the entire United States. And you can see there, I covered the states of Alabama, Georgia, Florida, and South Carolina. That's my particular region. I really want to encourage you to get to know your telehealth resource center, because they typically we keep our finger on the pulse of what's going on in the individual states. So wherever you might be located, if you have not done so already, I would encourage you to reach out to your telehealth resource center, visit their website, see what resources they have available for you, and get on any mailing list. A lot of times, like for myself, we do work group meetings and things of that nature. This is just a resources slide that I wanted to go ahead and put at the front of the presentation, just so you have this information. The Southeastern Telehealth Resource Center, that is me. This is my resources page. And as I noted, many of the telehealth resource centers around the country have their own resource page. And so what I try to do is I just try to keep this web page updated with updated information as much as possible, so that when people call me and they're looking for information around telemedicine, whether it be starting a program, whether it be best practices, We've been getting a lot of calls for consent forms. All this type of information I just keep in that one location. As a matter of fact, this morning I just updated it with a couple of videos. One is a kind of a quick start guide, a neat little video that the Pacific Basin group put together. So telehealthresourcecenter.org, this is all the resource centers together. So all 14 telehealth resource centers, we do function. Although we're 14 individual telehealth resource centers, we do function as one consortium. So we work together. We just felt like about 3 years ago that we were stronger and a much a greater organization if we pooled our resources together. And so that's what we did. And so we created the telehealthresourcecenter.org, which is the national website. And on that website, there's a lot of information, things, toolkits and all that, a lot of good stuff. So you want to check that website out and be familiar with that. So just some information here. The National School of Applied Telehealth, that's actually the Southeastern Telehealth Resource Center. It's our education arm. We have some online telehealth courses that are there. So what do we do as telehealth resource centers? So we basically serve the areas where we are located. We can help people out with things such as business models, equipment / platform / vendor selection. Now, I will say this, when it comes to selecting platforms and equipment and vendors, being a federally funded entity, we have to be very careful in assuring that we don't promote any one vendor over another. So we pretty much will remain agnostic as possible. And you'll see in a later slide, I'll talk about one of the TRCs has actually created a great resource. It's a vendor selection tool on their website, and it's a really great resource. And here again, going back and being connected into your telehealth resource center is a great way because they can kind of help you navigate some of those waters. Policy, we keep track of the policies in our region, practice guidelines, program development, so many more. So you want to be connected to your telehealth resource center if you can. The NCTRC, the National Consortium, all of us together, we do a webinar every Thursday, the third Thursday of every month. You can see here, this is Pacific time, 11 a.m. to 12 p.m. You can actually go back to the YouTube channel and you can watch previous webinars that we have done. And so this is a great learning tool if you need some access to some great information. And if you get on the CCHP mailing list, or if you're tied in and connected into your local telehealth resource center, this information will be made available to you as well. So I'm not going to spend a lot of time on this slide. I think probably you guys understand the terms telehealth, telemedicine. Telehealth is really the umbrella term. And it really encompasses a lot of things, such as telemedicine being one of them, but then electronic medical records, health information exchange, all this health care delivery kind of falls under that umbrella term of telehealth, whereas telemedicine really kind of dives into the delivery of clinical services using electronic communication means. That's really when you get into the telemedicine. Some other terms you're probably hearing, today are e-health, m-health, digital healthcare. I like to use the word virtual care because I think sometimes, or I used to always say previously up to this point, the term telemedicine brought about, so many different feelings with different people and in different worlds depending on who you were talking to. If you were talking to someone from a legal standpoint and you use the word telemedicine, red flags would always fly up. So I always like to tell people to use the term virtual healthcare. So the AMA has put together a really neat getting started tool. It's a kind of a startup guide. And so for those, some of you may fall into this category. I realize some of you probably already, maybe have been delivering care virtually, but some of you maybe need this information. So if you go out to my website, I have this on my website in a PDF document. These slides will also be provided to you once this webinar is over. You will have access to these slides, or you can access this information from the American Medical Association. But they recently put together this quick start guide. And so if you're getting started, there's some really great information here around getting started with providing virtual care. So things like, little basic stuff that you may not think about, setting up a team, for example, to help facilitate the implementation process. Check with your malpractice insurance. I had this, gotten this question quite a few times. What is malpractice carrier? So you're going to want to be aware of what your malpractice insurance says about virtual care. Is it covered in your malpractice, or is it something that has to be added on, say, via a waiver? Familiarize yourself with payment and policy guidelines. We'll talk a little bit about that in just a second. What about your EHR vendor? Do they offer a virtual platform option embedded into your electronic medical record that you're using? New technology, introducing new technology into practice quickly, which is what a lot of people are doing today, can really be a challenging thing. We have spent years, I've been in the telemedicine business now for 10 years. And for 10 years, up until this point, I have felt like it's been a constant battle, and we've constantly been encouraging and educating people on telemedicine and getting started. And, the intricacies, the little moving parts about getting a telemedicine or a virtual care practice started is something that really can take time depending on who you are. With some smaller practices, private practices, it can ramp up pretty quickly. Well, what people are facing today is kind of unprecedented times in the fact that they're needing to start yesterday. And so they're looking for information, they're looking for resources, and stuff like this can be very, very beneficial. So determine protocols. You're going to want to have protocols in place. Know your payer mix. Consider reaching out to your payers. Am I going to get paid for the services that I'm providing? Those are all things. So workflow, you get into all this. Ensure you're still properly documenting your visits. It's going to be interesting post COVID-19 and post the emergency, although a lot of your HIPAA requirements are being waived, and we've seen everything that's come out around Medicare and CMS and rules and regulations being relaxed and standards being relaxed and all that. But what I'm still encouraging people to do during this time as you're providing this care is you need to make sure that you are documenting, document. I think that's going to be the important thing, because we're already hearing of some claims that are people are calling saying, hey, we're not getting paid for this by this payer, or maybe it's by the MAC. And a lot of times what's happening is there's some misinformation, or there's some disjointed communication that's happening even with your payers. And so you're going to want to make sure as you're going through this time, even though a lot of these rules are relaxed and you can use platforms now from a Medicare standpoint and maybe just across the board that you traditionally would not use because they may not traditionally meet the standards set by HIPAA. So what you're going to want to do is you're going to want to make sure that you're documenting the care. So ensure you receive advance consent from patients. So this is one of the big topics right now. One of the things that's going on. Of course, Medicare has waived the written consent as far as visits go, and they're allowing for verbal consent. I will say this: most payers are allowing for verbal consent, but that's not a statement that I can make just, from a blanket standpoint, because individual payers, private payers can still set their own policy, especially interstate where, maybe the state hasn't come out and put forth a blanket policy. So, verbal consent may work for one particular payer, but then verbal consent, you may have another payer that's saying, hey, we still want to get the written consent. So just handle the consent thing and document. So when in the situation where you're obtaining verbal consent from the patient to do a virtual visit, you're going to want to make sure that you document in that record that you have gotten the verbal consent to do the visit from the patient. Very important. So let's kind of keep going here. So where do I start? As I mentioned earlier, you're going to want to have a plan. You've got to have a plan in place. Successful telemedicine programs, or let's say this, unsuccessful telemedicine programs or virtual care programs, you can kind of, a lot of times you trace them back to just where they started and how they started. Did they have a plan in place? Did they have a vision for the program and have a plan for what they wanted it to accomplish? Did they do the proper training, so forth and so on? I like this comment by Dr. Andrew Barbash. Using video is about workflow, not necessarily about technology. If it's too difficult to use or requires an app, it won't work for my needs. So telemedicine is governed at the state level. So unless, of course, Medicare, we've seen so much of the information that has come out. A lot of that information, the majority of that information deals with CMS and Medicare in particular. And so you still have to understand that telemedicine outside of Medicare is regulated at the state level. So you have to know what your state rules and regulations say about telemedicine in your particular state. And then once you look at your state rules and regulations, maybe you're in a state, say like Alabama, or you're in a state like Florida, which I cover, they're in my region, and there are no rules and regulations at the state level. So then you bump down and you have to look at what your payer, who it is you're going to be billing for your services. You have to look at their policies around telemedicine as well. And there has to be an understanding of what they will pay for and what they will not pay for. So you've got to know where you're located and what are the rules and the regulations from the state level. What are they, say, at the payer level? So here again, this is where being connected into your local regional telehealth resource center will be very beneficial for you, because they can also help you navigate these waters. So what's covered? Medicare, of course, is national, it is federal, so it doesn't vary and it doesn't differ from state to state. However, when you start dealing with Medicaid, Medicaid is governed at the state level. And so when you look at your Medicaid, you've got to understand what your state Medicaid allows and what they don't allow. Pretty much, I think all the states' Medicaid programs pay for some form of telemedicine program, telemedicine or virtual care. But what is their policy around telemedicine? Are there limitations? Are there restrictions that they place on the virtual care? And it's very important to understand that, especially during this time of COVID-19, where so much information is coming out, and you've got individual states that are doing kind of their own thing. So, and then you have to know from a private insurer standpoint. So right now, Georgia is one of a handful of states that has true parity legislation. In other words, the language and the rules of the state of Georgia basically require that mandates that all payers pay for telemedicine services at the same rate. So in other words, there's no differentiator between an in-person visit and a visit that's done virtually. All payers are mandated to pay. So that's not the case in every state. So here again, going back to your location and where you are located, it's very important to understand what the payer, what your landscape is when it comes to the payer. Choosing a platform. This is the tool that I had spoke of. The Mid-Atlantic Telehealth Resource Center has a really good vendor selection toolkit. You can also reach out to your local telehealth resource center, and they'll kind of help you navigate those waters. Listen, this is probably one of the more difficult things that I believe people deal with. Say in a of course, in a time like now, everyone's just kind of jumping in, and they're jumping at really whatever they can. A lot of people are using Skype and things of that nature, but you're going to want to make sure, and this is the encouragement that I have been given to people who call me, you're going to want to make sure that whatever you choose is scalable, that it'll grow with you, and that it's going to meet all the standards and requirements. Because listen, the emergency period is going to end. This COVID-19 pandemic and the state of emergency is going to end, and hopefully you'll still continue to deliver care virtually. So you're going to want to make sure that that program that you put in place is going to be able to move you forward, and it's going to meet all the standards that needs to be met from a security standpoint, from HIPAA and all that stuff that comes along with that. So, and if you Google telemedicine platform, you will see very quickly that there are a lot of platforms on the market today. The market has been saturated with platforms. So let's kind of go ahead and go through kind of as we begin to kind of wind down the presentation and give you guys some time to ask some questions. I guess we'll have some question time here at the end. But of course, there's been a lot of information come out around CMS. This last introduction of waivers that was passed really included a lot of information. There were a lot of changes, and with that comes a lot of information, and with that comes a lot of questions, and with that comes a lot of misinformation. So, one of the things after the first release after Medicare made their first changes, of course, they removed the rurality restriction. They removed the home, not being an eligible originating site. So they removed those barriers, did a few more little things to tweak to try to get people, to where they can provide services virtually, relaxing the restrictions on the platforms and so forth and so on. The problem was they did nothing to expand the coverage. So in other words, they made some changes, but they really didn't do anything that really expanded who could provide services and what services could be provided. And traditionally, Medicare has been one of the more restrictive, payment reimbursers. So they put a lot of restrictions. So I did put a notice in here. This came off of one of the documents. I've got the link here in this document as well. The approved document will be submitted to the Office of the Federal Register for publication, has not yet been placed in public display or published in the Federal Register. The document may vary slightly from the published document if minor editorial changes have been made during the OFR review process. The document published in the Federal Register is the official HHS approved document. Unless something has changed this morning, the changes still have not technically been published. And so I think there's still some things that they're working out, because as we go through these next slides, you're going to see probably where some of the confusion is coming from. And I can tell you there's a lot of conversations amongst us as telehealth resource centers about PT, OT, and SLP services. And so I'm sure you guys probably are as confused as a lot of people out there when it comes to these questions. So these were some of the bullet points that have been put out. And as you can see here, therapy services, physical and occupational, all levels, and then it lists the CPT codes, 97161, all these codes that are provided. Telehealth services expanded to new providers. Now, this is a bullet that was provided: licensed clinical social worker services, clinical psychologist, and then you can see, of course, PT services, OT services, and SLP services are now eligible to bill for Medicare telehealth services. So we, of course, when I first looked at this, I thought, hey, this is awesome. Now, I will say this, Medicaid in many of your states have already made the changes to allow PT, OT, and SLP services to be provided virtually. So here again, you're going to want to check with your Medicaid agency. Okay, Georgia Medicaid came out, and right off the bat, they opened up those services for the billing. And then a lot of your private payers are doing that as well. United Healthcare, for example, is one of those that come out and said, listen, across the board, we're going to pay for these services. So here again, I'm referencing the most recent waiver, the changes to Medicare, and I'm not talking about Medicaid or private payers. Parity for telehealth services. Providers billing for Medicare telehealth services can now report the PS code that would have been reported had the service been furnished in person. During the coronavirus PHE, providers can use the CPT telehealth modifiers, modifier 95, which should be applied to claim lines that describe services furnished via telehealth. So now this is the differentiator between what Medicare traditionally has done, in the sense that Medicare, back in, 2018, started using just the place of service code of 02 for telehealth claims. And so this is a little bit different. So there's some questions here as well around billing for the telehealth services. And so let me say this, it's important to understand that the full guidance has not yet been released around these changes that are made. So keep an eye out, it's kind of a wait and see. We, as the telehealth resource centers, we're not necessarily going to get the information before anybody else, but typically what we try to do is once the information comes in, we try to disseminate that out as much as possible. And so we're still waiting on the actual guidance around, and that's going to kind of give more of an explanation, I think. Virtual check-in. So here is something that right now, you guys can take advantage of these. Providers can now use virtual check-in services. I'm sure you guys have already seen this. But the change that was made here previously, the virtual check-ins were only for established patients. They've made the change, now it's for new and established patients. E-visits expanded to new providers. So here you can see they included the physical therapist, OT, and SLPs. Coverage for audio telephone. Providers can now provide certain services by telephone during the COVID-19 to both new and established patients. So here you see what they tried to do is answer as many of the questions as they possibly could and really remove more of the barriers. I have a feeling there's going to be more that will need to be done, and it's going to be really interesting once the guidance is actually released, what changes from, say, these documents that have been put out over the last, say, 3 days. Frequency limitations were lifted. Limitations on the number of times certain services that could be provided via telehealth have been eliminated for certain services, including subsequent inpatient visits, skilled nursing facility visits, and critical care consults. So IRF face-to-face requirement, rehab physicians to use telehealth services to conduct required 3 physician visits per week. So listen, I'm pulling this information is all coming off of this CMS.gov file, the COVID final IF.PDF. That if you can't find that document, it's going to be embedded. The link's going to be embedded here. It's on my website. It's on CCHP's website. So you can go find this document and familiarize yourself with it if you have not. All right, so here's the deal. So we all were kind of saying, hey, this is great. This removed some of the barriers that PT was facing. It made some really great changes. And then yesterday, we got a question from some folks who provide physical therapy services, and they said, look, the waiver did nothing to expand services to us to allow PT, OT, and SLP folks to be able to bill. It didn't add us. And so we began to dig and we began to read a little bit more. Maybe we missed something. And then we found this paragraph here in that same document that I've been referencing. And here's what it says. In light of PHE for the COVID-19 pandemic, we believe that the risks associated with confusion are outweighed by the potential benefits for circumstances when these services might be furnished via telehealth by eligible distance site practitioners. We believe this is sufficient clinical evidence to support the addition of therapy services to the Medicare telehealth list on Category 2 basis. And then here it is. However, we note that the statutory definition of distance site practitioners under Section 1834 of the Act does not include physical therapists, occupational therapists, or speech language pathologists, meaning that it does not provide for payment for these services as Medicare telehealth services when furnished by physical therapists, occupational therapists, or speech language pathologists. So here again, I'm not a billing expert, and I realize you know, if you've not seen this, or maybe you have heard this and you're aware of this and you've run into this yourself, from what this paragraph states, it doesn't look like that you guys, you know, the group or, you know, OT, PT, and SLP providers were actually placed into the expanded providers. In other words, if you go back up to the other paragraphs, the CPT codes apply to regular physicians now being able to bill for those CPT codes. So there's still, and I guess what I'm saying is there's still some questions that are not answered, and we're still waiting for the guidance to come out around these waivers. And I think the guidance will help answer a lot of the questions and hopefully alleviate some of the confusions. So I will say this, here again, I'm only talking about Medicare. This only references Medicare. You need to fully understand your Medicaid rules and regulations and your private payers as well. But from a Medicare standpoint, it doesn't look as though PT, OT, and SLP services, not the services, I guess, but that the providers still are going to have the barrier of billing Medicare for the services that you provide outside of, say, the e-visit code, the virtual visits, or the e-visits. So anyway, I know you're probably throwing tomatoes and things at the screen right now, and but please, 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 you know, figure out, get in touch with your local telehealth resource centers, get connected with us, and build a relationship, and let us help you as you kind of navigate those waters of getting, you know, virtual care going and trying to figure out, you know, what you can do, what you can't do, so forth and so on. So with that, John, I'm going to end the slide and the presentation, and then we can take questions if there are questions.
Okay, well, that's thanks for coming on today, Lloyd. I really appreciate it, and this is really what we were hoping, because it seems like, you know, it was really disappointing to hear the news about if you go back, the statutory act that has to be changed in order to lift either lift the eligible provider exclusion or include PTOT and SLP in the eligible provider category so that they can provide telehealth to patients. I think that that's what ABTA, AOTA, and ASH are actively working on. I don't know if the National Telehealth Resource Centers, you know, if that's something that they're weighing in on. But anyway, but from the feedback that we're hearing and what we're hearing from the other guests we had on last week, it seems to be going that way. We're waiting to hear from Secretary Verma's office about that change. So our goal at ACRM today was to educate folks that are out there. You know, you said it takes a long time to set up a successful telemedicine program, and it can take time. So we wanted to make people aware of the federal resources that are available to help you as you're, you know, trying to dive into the telemedicine waters. If you have questions about vendors, because it's a federal resource, they do have to be sort of agnostic as far as who they're promoting. And I think, Lloyd, you know, how do you decide what vendors that you're gonna put in front of folks? Is there a vetting process that you go through, or how do you decide kind of who to include in your list of resources? Or do you just kind of post that out there and show what ones do that others don't, or how do you go about that and still kind of stay neutral?
Yeah, so of course, you know, as most of us in the telehealth resource center world have been in telemedicine, and we've been around for a long time. So we're at all the ATA, American Telemedicine Association meetings. We attend HIMSS. You know, we're out there. So we build relationships with these vendors. I'm not going to say that there's quote unquote a vetting process, but we just kind of know. I mean, there are ones that I would say are trusted over others. And so when we provide information around those vendors, then, you know, part of the process is kind of knowing them and understanding, you know, how they operate, what type of platform there are. And two, you know, when you get into selecting platforms, I mean, there's web-based platforms, things, you know, such as Zoom. Of course, Zoom's all in the media today. If you didn't know who Zoom was, you probably do now. You know, so you got platforms like WebEx, and, you know, there's virtual platforms that are great for meetings, but then there are telemedicine platforms that are geared towards telemedicine, and they include things like, you know, integration into electronic medical records, and, you know, consent forms and things like that are actually come as part of that. A lot of what we see now is electronic medical records making an offering for, you know, for an embedded platform into the electronic medical record. So it's something that maybe you just turn on, and then there's a charge for it that's going to be additional. So, you know, when we make recommendations, we typically are going to give you a handful. I know if I make recommendations, usually sometimes there's 5 or 6 that I say, hey, these are great platforms. I mean, and they are. The problem that we run into today, though, and I've really kind of even gotten away from even trying to recommend 5 or 6, because there are so many platforms. Sometimes I feel bad because I know I'm leaving some out. And so there's a document that I just recently put on my website under the additional resources tab, and it's a guide, and it's got a bunch of various platforms that are listed with descriptions and things of that nature actually embedded in it. So it's a great document. And so you're going to find stuff like that with each of the regional telehealth resource centers. And so that's one of the reasons why I say, you know, get involved. You know, I would venture to say that most of us probably are going to recommend a lot of the same ones, but then some may have relationships, you know, Kathy Wibberley at Matrix, for example, she's the one that's got the vendor selection toolkit. And so she knows, she's probably familiar with a few more platforms than say I am. And so, of course, we get contacted by a lot of vendors who want to partner with us, but we're not really able, because we're federally funded, we're not able to partner with vendors. We have to, here again, we have to remain agnostic as possible. And I do want to say, I didn't mention this, but the services that we provide as telehealth resource centers, typically if you call us and you ask for information, and the information that we disseminate to people, that's free resources. So the only time we charge, HRSA does give us the okay to charge if it looks like the services that we provide may run into, say, like 10 or more hours of work. And so so sometimes we may charge, if we're doing business develop or a business plan or planning a program for you, or site surveys and things like that, we may ask to help cover some of the travel costs and things of that nature. But the services that we just typically on a daily basis provide are free services as well.
Yeah, and I think that's really good information for the people who are tuned in to hear. I mean, the American Telemedicine Association is a really good organization. I've worked with them. My company PT Pals worked with them as well, and they've been around for a really long time. And but it's a member organization, so a lot of their stuff, you're probably going to need to pay for. So not to say that there isn't high value there. If your organization can do it, it may be something to look at, joining. If telemedicine, telehealth is going to be part of PTOT speech long term, kind of looking beyond just the immediate emergency that we're facing. But this is going to be a long term thing. But that's why we wanted to bring the resource center on today, to let people know, what resources are out there that are free. Well, I mean, that we're paying for with our tax dollars. So take advantage of them.
Yeah.
Okay, well, that's great, Lloyd. We do have a couple of questions. I'm just gonna go through. Shanpin posted, in the webinar yesterday, and I think you cleared this with your last slide. Presenter stated therapists can do e-visits, virtual check-in, but not telehealth. It's conflicting with the codes you mentioned that were posted by CMS on 3030, on 330. So, just sort of, again, going back to that eligible provider exclusion. So that's what we're hoping is going to be lifted. But then a follow-up, is there a total number of e-visits per week that a patient can initiate? Do you know of
that limit? I believe that limit was lifted, if I'm not mistaken, on the e-visits. So I don't think there is a limit on e-visits. And one of the things they're trying to combat, though, really, and this kind of goes back to the documentation piece, is understand there's a lot of vendors who make money off of telemedicine visits. I mean, as you can imagine. And so really what they're trying to avoid is just having people call patients just out of the blue for no reason, and just, calling them on the phone, or trying to direct them to an e-visit, and then be able to bill for that service. And so I think the biggest thing's going to be to make sure that everything that you're doing, that you're documenting. Because if there are audits that come back on this, and I realize that what the OCR is saying is that they're relieving a lot of the restrictions, and they're going to use judgment, at the end of all this, from coming back in judgment. But at the same time, I think there's a lot to be said around visits that are done just for money. I mean, there's people who are going to try to take advantage of the situation. So,
well, and hopefully, hopefully not very many, because I think that they will be doing a big analysis of this after. And if we can show that it provides value, and it isn't, it has a very low level of abuse, that's going to guarantee, or not guarantee, that will be what's going to help us be able to continue to do this.
Yeah, it's changed. I had a conversation with someone the other day. It's really changed the way I think what's happened is telemedicine was growing anyway, but I think what it's done is it's changed the way healthcare will be delivered moving forward. So, and I think this is great. I think there's a lot of things that we have to work on. I think, you know, what we're doing here today, your group of people, as a matter of fact, I think it's still one of the barriers that's going to have to be overcome. And I will say this, I mean, OT, PT, and SLP services, payers coming on board with these services have been lagging for a while. I mean, and I think that's what we're seeing even right now. As a matter of fact, is, there's still a lot of head scratching. There's been head scratching around telemedicine and virtual care in general. But I think even with the PT services, in this realm, I still think there's some education that needs to be done. And I think this is going to provide an opportunity to kind of overcome some of those barriers.
Yeah. People are not understanding that there are services that can be promoted or provided, over the web to patients at home or whatever they happen to be. Yeah, absolutely.
I mean, the VA has a very good program that they do, from a therapy standpoint. And I mean, it's been demonstrated. And so I don't know if you're familiar with their program, but if you look into that, so it can be done. There's no doubt about it.
Well, that's great. One last question. So sort of on that same thread, for patient-initiated e-visits, there's nothing that you've seen where they can have multiples on the same day, as long as that's patient-initiated and not, sort of soliciting. Is that?
Yeah, I have not seen anything on that says they can't do that. Here again, I think probably the guidance, once it drops, I think the guidance will address that.
Okay.
And that's what we're waiting on right now. We're waiting on the actual guidance around the changes made in these waivers to actually come out. But I think what happened is the changes were so broad and so deep that it's obviously taking them a little bit longer to get the guidance out around actually, how these services are going to be paid and billed, so forth and so on.
Great. Well, Lloyd, thank you very much for coming on today. Really appreciate it. Folks that are listening, go out to to the National Consortium of Telehealth Resource Centers. Find your state, find your area. They've got lots of good information online for those of you that, telemedicine and telehealth is obviously very new to this field, so a lot of education is going to have to be done. These are, your tax dollars at work, folks. So reach out to them and use them to your advantage. So again, and we'll be posting all of Lloyd's information and everything he posted today, as well as the recording of the session on the ACRM Pandemic Resource webpage. And so it'll be available to you, and you can forward to others if they weren't able to tune in today. So we've got some guest speakers from Wuhan next week to talk about their experience, and some other guests that we're lining up. So we'll be doing Tuesday, Thursday, Friday again next week. So stay tuned for the upcoming shows. And Lloyd, have a good weekend. Everyone else,
thanks, guys. Really appreciate it. And if there's any other questions, please feel free to reach out.
Great. Have a good weekend at home.
Yep. Thank you.
All right.